Assalamu alaikum. The communication day, the first scenario. You are the doctor, and the patient's daughter is distressed and opposing further treatment because of her mother's advanced directives. Her mother is unconscious in ICU on a ventilator after a suspected amitriptyline overdose. So you're gonna talk with the daughter about the mother condition. You can start in seconds only after sharing the timer, or you can start now. Here you go.
Hello, good morning. My name is Dr. Abdurrahman. Can I confirm your name, please?
Yes, my name is Sarah. I am the daughter of Mrs. Stewart.
Okay. Welcome, Miss Sarah. So, Miss Sarah, we are here now to discuss some issues regarding the health condition of your mother. Miss Sarah, are you the next of kin of Mrs. Stewart?
Yes, I am her daughter, and I am her next of kin.
Okay. Miss Sarah, can you please tell me how much do you know about the health condition of your mother?
Well, I wasn't with her when this happened. They called me and they told me that my mother was found unconscious with empty bottle of drug called amyloidosis. And I'm here now. The doctor uh, told me that she is unconscious and she is on a machine to assess her breathing.
Okay. Thank you for sharing this information with me, Miss Sarah. Okay, Miss Sarah. What exactly do you expect from our meeting now?
Okay, I just wanted to make sure no one goes against her wishes. She was clear
Mhm.
about not wanting machines, no ventilator.
Mhm.
Appreciate your concern, Sarah.
Okay. Yeah, I appreciate your concern, Miss Sarah. So, Miss Sarah, yeah, about the condition of your mother, yeah, there is a possibility that she, because we found this amitriptyline beside her, there's a possibility that she ingested this amitriptyline. And because of that, she suffered from problem in her awareness and problem in her breathing. So she wasn't able to be breathing by herself. And when the team finds her like this, they need to follow the measures to try to save her life. And yes, yes, they put her in the ICU, and she is in the breathing machine to help her breathe. This she is in on the ventilator now.
But doctor, she has an advance directive. She doesn't want this. She told me so many times about this.
Mhm. I understand that, Miss Sarah. Okay, so when the team find Mrs. Stewart in this condition, the priority was to save her life, and the advance directive was not present in this situation because that was a situation, a critical situation, and we did not know about this advance directive at that time. And also, Miss Sarah, I need to ask you if this amitriptyline belonged to your mother. Do you know about this?
Yes, she had problem with her mood recently.
Mm-hmm.
But doctor, that doesn't change anything. She said no to machines. I don't understand why she is on the machine now.
I appreciate your concern, Ms. Sarah. Just let me ask you one question before answering your concern that might change our perspective about this condition. Do you recall exactly when she wrote her advance directive? Was it before she diagnosed with this mood problem or after? Are you sure about the time that she wrote this advance directive?
I'm not sure about the time.
Yeah. So based on that, now we need to save her life if we could do that, and then we might evaluate her condition after that and see what are her wishes. But for the time
She
being,
didn't want to suffer. She told me if she is unconscious and cannot speak for herself, she doesn't want any tubes.
okay. Appreciate that, Ms. Sarah. Of course, documented wishes from anyone who's having the capacity to have a decision should be respected, regardless of anything. I understand that now you understand her situation and her condition, and you understand that even if that could threaten her life, you want to go with her wishes, and this is her right. That's why I'm going to just make another meeting with my consultant and the legal counselor. So they are going to discuss this further with you and come up with the proper plan for this. Meanwhile, until the decision will come out, I'm going to discuss this with the management team to see if we will continue on this ventilator or stop it according to the decision of the legal counselor. How does this sound for you, Mrs. Sarah?
So you will just keep her on the ventilator now?
Yeah, as I really understand your point, but as I told you, in the time being, until we will revise this advanced directive, it should be that way. And when we are 100% sure that this is her wish and the advanced directive is legally correct, we are going to follow her wish. Of course, this is her right. Is it okay with you?
Yes, that's okay, doctor.
Okay. Okay. So, do you have any other concern for me, Mrs. Sarah?
No, for now I don't have any more concern.
So, Mrs. Sarah, I need to ask you some questions. With whom your mother was living?
She was living with me.
Okay. And what about her function before that happening and her daily activities?
2 minutes left.
She was suffering from low mood recently, and she had many troubles.
I'm so sorry for that. And I'm so sorry for what happened. And also, I'm sorry if this was inconvenient with her wishes, but we are going to revise this condition and correct anything if possible. Do you have any further concern for me?
No, thank you.
Okay. So if you need any help or anything, you can just contact us in this regard. Still
Okay.
time?
Yeah, one
I
more
don't know.
minute.
It's a very strange scenario. I don't know what to do.
Yeah, but it's a nice scenario. Go ahead. 1 minute
It's
remaining.
okay. It's okay. You have done it nice. I know it is difficult scenario. It appeared in UK in
And
the last event.
yeah, less also information in the scenario.
I think this was the
Mrs. Sarah,
information.
what do you think was the reason that your mother decided that she don't want to be saved in case that her life went to this situation?
I'm not sure, doctor. She was having troubles with her mood.
Mhm. Okay, so is your mother having like suicidal attempts before that or something?
No.
Okay. Uh, so this is maybe the first time for her, but
Okay, time is up, and you wish that.
alhamdulillah. Saved by the
I
not saved also.
I can understand that. But by the
Yes,
way,
very difficult, very
no,
difficult.
no,
She,
but you will know now the secret or the trick.
yeah,
I
this
don't even know
patient
the secret,
is
Dr. Basim.
suicidal. This patient
Yes,
is suicidal, but again,
yes,
the advanced directive, if it is,
This is
yeah,
it will not be
exactly.
advanced directive
When it
unless
was
it is
written,
documented legally. So it is
uh,
legal.
yes. So when it was written and what were the circumstances? But you're right,
Mm,
advanced directive different than the living wish, which is written and documented by the court.
yeah,
Yeah, let's
it
hear
is
Dr.
legally
Salma.
bounded. It is legally
Exactly, yeah,
bounded. Yeah, but I don't want to rush into that. We will respect
yeah,
it and
I
stop
agree.
ventilator
You
because,
answer in a diplomatic way,
yeah,
which is
yeah,
I agree with this. I think it's perfect to mention and to do the same with such issue. Let's hear Dr. Ala comment, then I will comment. Yeah, Dr. Ala,
yeah.
please.
Please,
I, I,
please, Doctor
I,
Ala.
I don't know really. I just saw the scenario in the recalls from UK in the last date. It was written as this: speak to a daughter about her mother who has advanced directive for no ventilator. Mother was found unconscious with empty amyloidosis bottle, and she is on the ventilator now. That daughter doesn't want any further treatment based on the advanced directive. It's very difficult scenario. I don't know how even to approach this.
Okay, great. So you just bring to practice it and to know how to address it. Let's speak it in two ways. As Dr. Salma said, this is advanced directive. So it was documented in the court, and no one will go to the court unless he is having full capacity, right? But
Right,
still, you don't know and you don't have any guarantee that she is not in low mood. And we don't know when it was written. She was in low mood or she was fine. That's why the good question here to know how about the low mood, since when? And since when this advanced directive written? It was in the same duration. If in the same duration, so means this advanced directive still there is doubt about it, right? She has low mood and
Yes.
we cannot judge on person capacity
Mm,
or decisions when he's in low mood.
yes.
We discussed this before. We have discussed such scenario before. So in general, you cannot judge on this in her capacity, and this advanced directive is still you have doubt about it. Why? Because she wrote it unless she was okay. So the good question to know when she wrote this advanced directive, was she in low mood? If she was in low mood, so it's clear that it is not valid. And this is what you did. Plus some questions about the circumstances. Did she, as you said, did she had any have any suicidal thoughts? Did she wrote a letter? She did she lock the door? Because the daughter is living with her. If she lived with her, means she has contact with her recently, and she will know what would be
I think
her
Dr. Salma
behavior.
didn't mention this point.
Sorry.
I think Dr. Salma didn't mention the circumstances.
Yeah,
Yeah,
that's why I wrote it in the chat box. You have to ask about the circumstances when it
mhm.
talk this in
Because they
detail.
said the medical team find her, not the daughter. So I thought that maybe she don't know about the circumstances. That's why I asked her, is this the first attempt? And how was her mood when she wrote the advance directive? I asked those two questions. Maybe she know about
Yeah,
it.
but she will know
Yeah.
if she left a paper, if she
Mm.
wrote a letter, or if she locked the
Yeah.
door,
Yeah.
or if she do such even before, or this is the first occasion. I think we have to
Mm.
ask three questions about the suicidal thoughts. If we
Mm-hmm.
confirm this patient is having suicidal attempt, I cannot judge on her advance directive, particularly if she wrote it in the same duration of her low mood. Okay? The same
Yes, I
idea
think this
if
is the point.
yeah, I agree with that. Same idea if she wrote it, if she expressed living wish while she is in low mood. So the same idea. You cannot judge on her advanced directive or living wish. But if this advanced directive was before the low mood, we will respect it. As you said, Dr. Salma, we will respect it, start checking and revising the file, the records, along with the legal advisor team. So it will be suspended till we will discuss it with the legal advisor team. So I think you did it in a diplomatic and perfect way. But I don't know the examiner. Will they accept to be diplomatic or do you want to be as a
Mm.
straightforward? You know, the
I
examiner
just
nowadays, yeah.
one thought come in my mind that if I asked questions like about the advanced directive itself, what the legal counselor will do. I think I have to stuck to my rule as a doctor.
No,
Yeah.
they will revise the date, for example,
Mm,
the date,
mm,
and they will revise with the medical team. Is it valid? Then, if still valid, we can disconnect the patient, or after patient improving, they can assess her mental capacity.
mhm,
And if it's still in low mood, they will cancel it, definitely, and they will
mm,
continue managing
mm,
her. But if she
mm,
is good mood, nothing happened there, the mental team said saying she is fine, so they can
mhm,
discuss this issue again with her, and they can withdraw the other medication in the future, for example. So
mm,
everything will depend on the circumstances and the advanced directive itself, the timing, the team. It's not straightforward scenario. That's why
mm,
it's difficult scenario really. But at least we have discussed together now. Anyone will have the scenario in the exam. Of course, it will be more clear. They will not bring the scenario in this way. I think there is more hidden agenda. Either it was written and it was missed by the one wrote the scenario, or it
mm,
will be more clear in the exam that the advanced directive when she was fine. So if the advanced directive when she was fine, I think we can also respect these wishes.
mm.
However, the medical team should also revise the condition with the legal advisor. This is my also opinion. I think this is the most accepted opinion. To be again diplomatic, you cannot judge in her condition now while she took the medication in no mood and she wrote even the advanced directive when she was fine. Now that everything is different, right?
Yeah.
Do you think you can
Yes,
accept the
I
advanced
agree
directive?
with you, Dr. Bassam.
Yeah, so it's difficult to apply this advanced directive on patient took medication for suicide attempt and we will let her die. I think this is injustice to let her die or to follow her advanced directive.
Mm,
So again, we'll go back for waiting for a legal advisor to revise. We will treat her right now. You cannot respect this advanced directive right now because it was in low mood and she took the medication also in low mood. We have to treat this condition right now. This is, I think, the final
and
decision.
the other thing, Dr. Basim, I asked her how was her condition, her health condition before that. She mentioned only the low mood. she didn't mention that she's having like COPD, and
Exactly, yes.
she tried the ventilator before, and she's fed up with the ventilator. That's why she don't
You
want
know,
it. If she has a contact or
perfect.
history with the ventilator, I would accept that the main reason
Yes,
that she don't want the ventilator itself. But now it looks like she wrote the advance
yeah,
directive and commit suicide.
yeah,
So
I agree.
yeah, yeah,
So it seems like we are helping her to kill herself if we follow this advanced diet,
Yes.
right? So if there is medical comorbidity, it will be much easy for us. Why? Because the
yes,
decision now will be for the medical team, regardless she
yes.
took it in the mood or because she will not get benefit from the ventilator, for example,
Mhm,
she will suffer the quality of life. You have to mention the quality of life in every scenario, such our scenario today. Why? Because always
mhm,
our aim to give the patient priority and his quality of life to be in good way, to maintain the dignity. But if she took this medicine in low modes and she already had any medical problem and now connected the ventilator, respiratory failure, coma, I don't think it will be wise to treat her medical condition. Agree for that?
I
yes.
agree.
Yeah, okay. Any suggestion, any comment, or any thoughts, any question, any doubt? Anyone talking? I think by mistake someone is talking. Dr. Yasser, you want to say something? Dr. Yasser?
Anyway, Dr. Basim, I
Uh-huh.
heard before, even advance directive, if it is against the best interest of the patient, we have to include the legal advisory.
Exactly.
Yeah,
Yes,
even in any other situation, if it is going
exactly.
against the best interest, we have to include the legal department, not just
Perfect.
to take the decision based on the advance directive only, in case it is again it is going against the best interest.
Yeah. Imagine
Uh,
this happened while she's in low mood, so we cannot judge on
yeah, we
it at
cannot
all.
depend on it. Yes, but advance directive could be respected and followed immediately if it is with the best interest of the patient. Like a patient
Agree.
in the life issue, and he wrote in the advance directive that he don't want CPR. In this case, the medical team will decide no CPR, and the advance directive is going with this decision. So in this case, the advance directive in the best interest and with the medical team decision itself. So we will follow it.
Yes, well done, Dr. Sama. Yes, I agree with that. Absolutely right. Yeah, Dr. Maida here with us. You can hear her opinion from UK point of view.
Yeah, I completely agree. This is
Yeah,
exactly what they are did when there is even if there is advanced directive and if there is any conflict between the advanced directive and the best of interest, they always go to uh, they consult the legal team.
exactly.
Yeah.
So the same opinion, yes.
Mm.
Thank you, Dr. Maida. Dr. Ayman Sheikh also wrote the same. Sorry, I revised it. Yes, if patient has no capacity if he has suicidal attempts, except after assessment by mental physician and legal advice. Yeah, I agree. Even the advanced directive before this suicide attempt, I cannot judge on it. Even the advanced directive was after, it will not be accepted. So in both ways, we cannot judge or we cannot depend on the advanced directive. Why? Because the attempts now, or the attempt, or the second attempt now, aborted this decision or aborted these wishes or advanced directive. So we have to wait until we assist again and we check if it be valid by the legal advisor team.
Mm. But
Perfect.
normally
Thank
at the end they go for the what the patient wishes, because they think always but they involve the legal team. After involving the legal team and everything, at the end they will do the patient wishes, because they think the best, what we are thinking as a doctor as best of interest, is something as subjective. So it's still the patient wishes are respected, but
Yeah,
under
we're
legal everything,
yeah.
after
After
involving
following,
everyone.
Yeah,
agreed.
I thought the same, Dr. Miyada. That's why I told the daughter that don't worry, we are going to respect the wishes of your mother. But after we consult the legal advice, meanwhile, we are continue to give our treatment,
The
and
best
we will
interest.
continue the
Yeah.
ventilator until we heard from the legal advice.
Completely agree.
Yeah.
Yeah.
If the patient medical condition deteriorated, multi-organ failure, so in this time we cannot do anything. Even we'll try to treat her, but she's not improving for any medical reason. So we will, in the best interest again, we will follow these wishes, and maybe we will discontinue the ventilator. But this, under one occasion, the patient condition is not improving, and there is some medical comorbidities that will not help us to continue treatment. So we can follow the wishes in the best interest for the medical point of view, not as the wishes only, no, because the medical team now they cannot do or they cannot offer anything for her. Is it clear this point, the last point?
Yes. Dr. Ala, my scenario is very easy, inshallah.
Yeah, very easy. Okay, so let's read the scenario. Mrs. Maria, 43 years old, present with weight loss, weakness, fatigue, waxy papule on face and trunk. Macroglossia, blood urea of 84, creatinine 2.5 milligram per deciliter, albumin 3 plus. Diagnosis of amyloidosis was expected. Your task: explain the result, discuss the possible diagnosis amyloidosis, as well as addressing the patient concern. I will read this comment. If you are ready, Dr. Ala, let's start. Dr. Goda wrote, advanced directive is well appreciated only if related to debilitating chronic illness like cancer system failure that ultimately lead finally to lose their mental capacity to take decision. Perfect. Otherwise, if she wrote it in the best interest for her suicide, it will not be followed. If you're ready, Dr. Ala, we can start. Just
I'm ready.
okay, here you go.
Okay. Hello, I'm Dr. Ala. I'm one of the doctors in the charge today. May I confirm your Mrs. Maria, 43 years old?
Yes, I am.
Okay. Mrs. Maria, we are meeting today to discuss some of your health issue and the result of your recent investigation. Is that okay with you?
Yes, doctor, please.
Okay. Would you like anyone to attend the meeting with us?
I am alone, doctor.
Okay.
It's okay.
Okay. First, would you please tell me what you have been told so far about this investigation?
Nothing, actually. Nobody tell me anything. I'm waiting for the for the diagnosis. I'm waiting for the results.
Okay. So I see from your notes that you were suffering from some weight loss and tiredness and some papules in your face and the trunk and a lot of other symptoms. We have
Mhm.
done some investigation for you, and
Mhm.
unfortunately, they are not as we hope.
What do you mean, doctor? Is it cancer?
Well, we found that your kidney is not functioning well, and also there is leakage of protein in your water work. So the treating team is suspecting a diagnosis called amyloidosis. Have you ever heard about this?
Okay, so you are saying my condition is called amyloidosis, and that is not a cancer.
Yes.
Okay, doctor, that's very good news actually, because with the loss of weight and all things that's going on with me and the tiredness and weakness that I'm suffering from, I was afraid that might be a cancer.
Well, till now we are highly suspecting this condition, but we will need to confirm it further by another test.
Ah, so you are saying you are not sure about the diagnosis?
Well, till now, not yet. Have you ever heard about amyloidosis itself?
No, never.
No. Would you like me to explain to you more about it?
Yes, please, doctor. It looks something mysterious. I never heard about it.
Well, I appreciate this can be difficult for you, but I will try. Well, it is a condition where there is abnormal protein builds up in different parts of your body, such as the kidneys, the skin, your tongue. And when this happens, it will interfere with how these organs work.
Mm-hmm.
So that is why we saw your kidney function is not in the optimal range, and we also see that it is leaky for protein.
Mm-hmm.
On
So, doctor, I'm still not understanding from where I get this disease.
Well, this disease can happen on its own or can happen to secondary to something else. We will make more investigation to find out and have a clear picture of what you have.
Mm-hmm. Okay, so, doctor, is it like inherited, like running in family or something?
Well, most forms of this disease are not inherited, but we will explore the type you have to understand this better.
Mm-hmm. So, doctor, if it is inherited, because you are saying most, so some are inherited, am I going to pass this to my children?
Well, I appreciate how worried you are. I will involve the genetic counselor to address any further worries you have, but it is too early to say this. We will need to confirm our diagnosis by a SNP test
Mm-hmm.
and to analyze it to have a clear picture of the type you have.
A SNP test. So, from where you are going to take this SNP test?
Well, we can have a SNP test from different areas from your body, like your skin, like your bottom.
Mm-hmm. Okay. Uh, okay, doctor. So, is this mysterious disease curable? Is there any treatment for this disease?
Well, I appreciate your concern. It may not be fully curable, but there are treatments to can help stop the protein build up and manage your symptoms. The earlier we treat it, the better we can protect your organs.
How are you going to treat it?
Well, we will refer you to a group of doctor from
Mhm.
a medicine doctor, a kidney doctor, to evaluate you further and give you the best management plan according to your condition.
Mhm. So, doctor, I have one child, and I was planning to have my second child this year. Is it going to interfere with my plans?
Well, I appreciate your concern, it is better to have a shared decision between your woman doctor and the medicine doctor to have the best management plan for you and to arrange for your pregnancy.
Okay.
Okay, do you have any other concern?
No, doctor. So we have to wait until this diagnosis would be confirmed. Okay.
Yes. Yes, I will arrange the SNP test as soon as possible. Then we will have another meeting to discuss the result and the further management plan.
Okay.
Okay, may I ask you some social question if you don't mind?
I don't mind. No
Okay.
problem.
Do you smoke?
Yes.
How many cigarettes per day? For how long?
2 minutes
Just
left.
like 3 cigarettes per day for the last 3 years.
Okay, well, smoking in any amount is hazardous to your health. So you advise to stop smoking, and if you need any help, we can refer you to the smoking cessation clinic.
Okay.
Okay, do you drink alcohol?
No.
Okay, and with whom do you live?
With my husband.
Okay, and what is your job?
I'm working as a journalist.
Okay, and do you think that your symptoms and your condition has affected your job and your usual daily activity?
Yes, too much. It impacted my job too much. I cannot go, I'm a journalist, so I have to roam around like this. But nowadays, because of the tiredness, it has been very limited.
I'm really sorry for that. I will involve our occupational health care worker to address any troubles you have. Is that okay?
Thank you.
Do you have any further concern?
No.
Okay, I will provide you with brochures and leaflet and website to read more about your condition and also about the SNP test we will do, along with the contact number of our department to reach out if you have any questions. Is that okay?
It's okay.
Okay, any further concern?
No, thank you.
Thank you. May I
Perfect,
have
Dr.
done?
Ala. Yeah,
Very well
perfect.
done.
MashaAllah, perfect.
Very well done, mashallah. Yes.
You can continue,
Um,
Dr.
yeah. I think he did it very well. When you are explaining a disease, specifically like amyloidosis, some doctors don't know more about amyloidosis. You need to put it all at once. So any disease, of course, you will did it like breaking bad news as you did, and after that, explaining the disease. Start with the etiology. It's very important in a disease like this because this amyloidosis is not common, not well known. So the etiology of amyloidosis is actually unknown. So the surrogate or the patient will not ask you when you start with this sentence that it is of unknown or we don't know exactly why this disease occur. Okay, then after the etiology, the pathophysiology, exactly like what you did. That it's I think it's a defensive system also. Your own defensive system attack your body, I think, or something, resulting in a buildup of abnormal protein
No,
called amyloid. I'm
I
not
think
sure.
it's the deposition of some proteins,
Yeah,
abnormal protein, but it's not defense system. I don't think there is relation.
maybe.
Yeah, so
Yeah, maybe.
abnormal
I don't know.
deposition or deposition of abnormal protein in your
Abnormal
blood,
protein. I think, yeah,
in your body,
he
yes.
discussed the pathophysiology very good.
Yeah,
That
perfect,
is a
yes.
deposition of
But it's
abnormal
not
protein.
defense.
Okay.
Because you said earlier it's unknown. So now you cannot say defense. Unknown means
Yes.
it's not defense. So don't mention defense now. It's
I
unknown
Yes.
as you
leave
said.
it like
Ye-
primary and secondary. I said it can be on
Very,
its own or
Yeah,
secondary
this
to
this
primary.
what I am coming to you,
yeah.
that
Okay, go ahead.
you just break it all together, because if you make it as pieces, the patient will be more confused. So all together, you just put in your mind in any disease that you will start with the etiology and non-etiology in amyloidosis. Then pathophysiology, it's a buildup, exactly as what you said, buildup of abnormal proteins called amyloid, and this buildup will be in different organs in the body, like your kidneys, your joints, even your liver, like this,
Skin.
resulting your skin, yes, resulting in the manifestation that you presented with, the symptoms that you presented with. After that, you will. This is the clinical picture. After that, you will talk about the types. Actually, this disease can come in different types, and this according to the type of the protein itself that will be deposited, and also according to your health condition before start this disease. So there is a primary one and there is a secondary one. Okay. In your case, your condition before that was completely healthy. So we suspect that if it is amyloidosis, it will be like the primary one. Okay. Or just to explain that there are types of amyloidosis. Then after that, you will go to the complications. We always mention complications immediately before the suggested plan of treatment, to convince the patient for the plan of treatment, whatever was the disease. So what are the possible complications of amyloidosis? It can affect the organs that it will be deposited in, resulting in dysfunction of these organs. Like if in the kidney, it will, it might make your kidneys fail. And you mentioned the most serious complications. Like in it sometimes it increases the size of the organs, like in your tongue. She's having macroglosia, so she know about this. So it sometimes increase the size of the organ, like what happened to your tongue, and also to the liver. It can increase the size of the liver. It can also make other serious complications, and sometimes it is associated. I don't know if we have to mention also the cancer, because it is associated with multiple myeloma and Waldenstrom and all these things. So after I finish, you can comment on this, Dr. Basim and Dr. Ala. Okay, then after that, the suggested plan of treatment. The patient will be ready to hear about the plan of treatment. Of course, every time you check the understanding. Then the suggested plan of treatment, as usual, multi-specialty teams. There are different types of treatment according to the situation. What we need to do now is to do further tests to confirm our suspected diagnosis, because it is still not confirmed. One of these tests is a SNP test. Like you mentioned, this is the second task. This SNP test could be taken from different organs in your body, specifically the organs that showing the manifestations or the symptoms, like your kidney, your skin, and different organs. I'm sorry to tell you that this type of disease is incurable, not curable, but we are going to do our best to control the symptoms. خلاص. This is the end of the explanation. Then you will be ready for her concerns. And you answered all the concerns perfectly, I believe. Thank you, Dr. Ala.
Yeah,
Thank you,
perfect.
Dr. Ahmed.
Good
Yeah.
explanation as well, Dr. Salma, and good scenario. I agree with Dr. Guda, the types of, we can, particularly if she asks about the family or inherited, there is possibility to be type 1, which is familiar. So we
Yes.
don't know exactly what is the type. But if she asked about the familiar, so we can say, particularly, there is, yes, one type of them. It might run in family, and you have a risk to be running in your family to your kids. But again, as Dr. Ala said, it's not confirmed yet. So we no hurry to answer this, but we will try to address this concern after confirming the diagnosis. And also the point of pregnancy, perfect answer. Always
Yes.
be in a safe side. Refer to the concerned team, and the team will assess, and we will follow to tell her how to do and what to do to have safe pregnancy. Always keep saying safe pregnancy and safe baby. Why? Because what's our aim in all these situations to have safe pregnancy and safe baby, right? This is our aim. So mention them while you are saying we will refer you to the woman doctor in order to have safe pregnancy and safe baby as well. I think others concern also was perfect, but I'm not agree to explain more about the skin or snip. It might just be as a next further investigation, but I will not explain more about it because it's not mentioned in the scenario. So as you said, Dr. Ala, earlier, we will take some snips from parts of your body. If she asks you particularly, you can say we can detect it in the next meeting because you don't know what is this type. Is it in the kidney, so you get a kidney snip, or it is from the skin or from the anal skin. So you biopsy, so you have a lot of parts. But what's mentioned here is not right. As a clinical judgment point of view, yes, you can say we will do further test, which might be skin test or sorry, snip. But from where we don't know. We don't know which type and what exactly the snip can help us to diagnose this condition. This is my opinion. I don't know if also we are discussing together. Is it okay to mention the area now? Because it's not mentioned in the scenario. What do you think,
Well, I
Dr.
think
Salvi?
you couldn't mention the area definitely. You may say we can take it from many areas of your body like this, like this. Just let him.
Actually, Dr. Basim, I brought this scenario because amyloidosis is scary for most of the doctors. So I want us to be familiar with this amyloidosis and to study it together and explain and
Perfect.
yeah,
Really,
explain
this
it.
is the best way
Yeah,
to discuss and to memorize topic,
yeah,
to practice it.
yes,
But anyway, as a
yeah,
candidate, as a surrogate, to ask your partner to do to prepare it for you, to do it as a
yeah,
surrogate, it's perfect topic. And by the way, it was nightmares for me.
yeah. For me also. That's why I brought this scenario. Second
Types,
thing,
but
yeah,
yeah,
Dr. Basim, the aim of the counseling of the disease that to make the patient know what to expect. So the patient should know what to expect that will be done for her, because the next step in this scenario that they will do investigation for her to confirm the diagnosis. One of these investigations is SNP. So you can just mention that further investigations will be done for you. It include urine test, blood test, images, and even a SNP, because the definitive diagnosis of amyloidosis is with the biopsy. We have to touch the SNP and make her know what to expect in the future. They will definitely they will take a SNP. This is the definitive diagnosis of amyloidosis. This SNP could be taken from different parts of your body according to the other test and the manifestation that you are showing. Just
absolutely right.
yeah.
I agree with you.
Mm.
So you have to mention the snip test. I agree, but from
Mm.
what part? I think not to be detected. Don't mention particular type. As Dr. Ala said, he said mention many types or many areas.
Mm.
So don't rush to say either from the kidney or from the skin or from the anal area or from your back passage. Just mention multiple areas it might be taken from, but don't specify. So again, we will be assess you again to detect which part, because you ask this question as a concern. Why I read this question or why I repeat this information? Because it was a concern. So not to be specific or specified in answering a concern like this. If you mention some parts, maybe you will be in trouble. If you mention, for example, we'll get the snip from your kidney. Who told you this? It would be from the kidney. It could be, but it's not mentioned in the scenario. You got my point.
Yes, I got your point.
So I believe Dr. Ala did all concern perfectly, and he did it in calm way. He was very confident while answering all concerns.
Yeah,
Yeah,
that's the thing. That's the thing which I
yeah,
like.
exactly. And this is the thing you should be on during the exam. To take a breath, think what you will say in seconds only, then start to mention. If you are not 100% sure about it, just mention it in the diplomatic way, refer it to someone or some specialty that will help to do to be a clear, give us a clear decision or opinion. Exactly as Dr. Ala did. Okay, the last question, of course, I agree to do the social, smoking alcohol, and the job, of course. But I believe, Dr. Ala, if she mentioned that she's unable to do her daily activity or her daily job, you can temporarily, you can address the sick leave for her. We can give you a sick leave just to help you to recover from this condition, so and when you are okay, you can go back to your work.
Well, I read it from a book that
Okay.
sick leave is not our thing, yani, to do.
Yeah. The occupational health department will provide this sick leave.
But again, we hear it also from multiple mentors that you can give a sick leave. Why not? If you are an emergency physician, you can give sick leave. If you are the specialty physician, you can give sick leave. Why not? What do you think? Some pain only
I'm not
for
sure
the pain,
about
you can give sick leave. Pain, only pain. For example, if someone came with even flu, right? You are giving sick leave for 1 day or 2 days accordingly. And this patient told you, I'm not able to do anything. I cannot do my daily work. So, and again, I said it before. I provide sick leave in 2 scenarios, and I got full marks. They didn't minus me. It's your job to give sick leave for any patient.
I
Anyone
think
have? Yeah, Dr. Mayada, please.
because here you can give yourself sick leave up to 7 weeks. Like if I feel like I am weak, even if I'm not doctor, for 7 days you give yourself sick leave. No one will ask you why. After that, if it's above 7 days, you need to bring it from your GP or from the doctor if you are in the hospital. If you are admitted in the hospital, so you bring from the hospital. Normally, if I think with this amyloidosis will be long term. It's very long term. She will be like fatigue for a long time. She will not
Yes.
work for a long time. So this needs occupational.
Yeah, I agree. For the short period, currently or
Up to
meanwhile.
7 days, she can give herself. Up to 7 days, you can give yourself. It's allowed.
Yeah, you will not give for the lifelong, for
No,
example, or long duration.
not from the doctor. The patient himself just called the word. I am not feeling okay. They will accept this for 7 days.
I
But I think
understand
Beyond
her
7
point,
days,
Dr. Basim. She's saying that if you face a condition which is temporary and short-term
you can provide
affecting,
sick leave.
but you
Yeah.
can provide sick leave. But in long-term conditions like this, you cannot provide sick leave because it's a long-term condition. So she need to meet the occupational health department to talk more about the impact and how to address this impact and how to help her more. She cannot
I agree.
definitely, and some type of treatment in amyloidosis also is chemotherapy, bone
Yeah.
marrow transplantation, a lot
Yes.
of aggressive treatment she might need in her future. That's why maybe she cannot go back to her work. She need to be
Perfect.
under
So
the
what's the best
assessment and
solution?
follow-up.
So what will be the best solution for the long term?
Refer
Reallocation.
to the occupational,
Yeah, occupational
but
reallocate
not you.
here. Yes,
Yeah,
yes, not me, but the occupation. This
yeah,
time, perfect to refer to the occupational team, but not
yeah.
from the first moment you refer to the occupational. You got my point.
Mm-hmm.
So you can give her initially sick leave for certain weeks or for certain days, and later on, she might be reviewed by the occupational team to reallocate her. I agree with this. Okay.
Okay.
What I mean, Dr. Ala, any acute condition in the exam, you can provide sick leave safely.
Okay.
Like, for example, headache, patient came with a subarachnoid hemorrhage, MI, stroke. Definitely, you can give him sick leave. But for the long term, such patients with the long-term disease or manifestation, you can initially either provide sick leave or you can say to her, I will refer you to the occupational health team to reallocate you in another position, which would be more easy for you to tolerate.
Okay.
So
Okay.
Thank you,
I have
Dr.
a question.
Yeah.
In my scenario, amyloidosis, if there is time in the exam, in the end, and you don't know how to fill it, you can just recap or ask the patient to recap for you. But the scenario of this angry daughter,
Yeah.
uh, I have 2 minutes left. I don't know what to do with it. But I was thinking at that time, shall I recap? Shall I summarize? I cannot. So, what do you think the solution in this case?
Yeah. I think the support, it's most important and essential to repeat and to offer and to ask for concern rather than asking
Mm,
for recapping or to tell you what she
yeah.
understood from the meeting. You will be in trouble if she feel angry again or if she express her angry feeling again. The examiner
Yes.
will put it as negative feedback, definitely.
Mm,
So the best way is to offer help again, to ask for this support, to ask for the family who's living with you, the job, the social. If you finish all the
mm, mm,
things, leaflet, brochure, website,
mm.
I think this will be enough. But check if you miss something in the scenario. Maybe you miss something as complication, red flags. I really like to fill the last couple of minutes or seconds with the red flag or safety netting. For, for example, in this situation, in this scenario, if Dr. Ala finish earlier and he have some time, he can give her safety netting. About what? About if you
This,
feel your
yeah,
tell me.
this disease is progressive,
Perfect.
and there is no cure for it. So some symptoms or some other manifestations might appear to you if you feel shortness of breath,
Perfect.
pain in your joints,
The most serious.
yeah, the tiredness became more. That
The
might
kidney.
indicate, yeah, the kidney function. Yes, yes, the
Oliguria.
problem in your urine. Yeah,
Yeah.
I recommend you to contact the health team.
Either the
Yeah,
GP, your
yeah,
GP,
your GP
immediately
also. Yeah.
or visit the ER immediately. Why? The patient might have renal failure, for example. This is the most serious. I believe the most serious complication for amyloidosis would be the renal
Renal
failure.
failure. Yeah,
Yeah, so patient
that's
will be
right.
in acute kidney injury,
Mm,
might need dialysis. This is the most, or heart failure due to restrictive
mm,
cardiomyopathy as well. It might be also one of the complications. So I believe you can, or Dr. Ala, supposed to tell about the complication. what would be the
Mm.
possible complication of this disease. It might be deposit in the skin, but it sometimes deposit in serious organs, which is very important organs in our body, like heart, like kidneys.
Mm.
If this happen, it might lead to failure or failure of this organ to carry her or its organ, its function. Sorry. So it's important to mention the complication. I think Dr. Ala didn't go through the complication, only he mentioned the manifestation, right?
Yeah, I did mention that
Mm.
it can cause failure of these organs, just it.
Perfect. Yeah, but I believe the heart and the kidneys might be the most important organs, might be damaged by amyloidosis, and it might lead to the failure. In this situation, the patient need to be aware about the seriousness of this complication. The kidney failure might need dialysis. Heart failure might need also intervention by the heart doctor.
Okay.
Okay. Thank you, Dr. Ala. Well done. Really, I like your performance today. You're so calm, confident, which is the best thing to do during the exam.
Thank
Try
you,
to
Doctor.
keep on the same behavior, and hopefully it will make everything and every scenario easy for you. Thank you, Dr. Judah also wrote a lot of slides. I cannot read all of them. Please, if you can send it to the WhatsApp group to refresh
Yeah,
ourselves.
yeah. You remind me. I want to answer
Yeah.
him. He wrote SNPs is mandatory. Then consent should be discussed.
Mhm,
Yes, that's true, but not in this scenario because the diagnosis is not yet confirmed.
mhm,
It is suspected. So if the scenario was that the diagnosis of amyloidosis was confirmed,
mhm.
of course, in this
Will be
case,
confirmed by the SNP.
or if the scenario tell you go and discuss the
Yeah, your
biopsy with
snip
the
is still.
patient,
Yeah, yeah.
discuss the biopsy clearly, then you have to take the consent. But in this scenario, they are suspecting, they need to do further test, then they will go to the SNP after that. I
But
don't know.
I agree, Dr. Salma. Any procedure, remind yourself and try to remember in the exam, I should mention the consent. In one sentence, as every procedure, we have to sign a paper called consent. We can address this later on. In one sentence, don't go deep in these details. Briefly, it might,
Yeah, I understand you. Yeah,
yeah.
yeah.
So remind yourself and ourselves
Mm.
always when I mention any procedure, even a skin test, it's one of the procedures. So I might need a consent. In this way, make it as a habit. Any procedure to be explained, I should put the consent in my task. Okay?
Okay.
Although it's not the main task, but it should be mentioned. It will not harm you. It will add you some points or some marks because
Yeah,
it's one of the important things. Yes.
I got your idea, yes, and
Yes.
Dr. Judith's idea, yes. So when we are discussing the possible investigations that should be done for her, we will say that and even a SNP could
Mhm.
be taken from different organs in
Exactly.
your body, and in this
Exactly.
case, a consent will be taken from you.
Yeah. We will address
Okay.
this in another
Or
meeting.
offered to you. Okay.
Yes. Okay, Dr. As can we ask him, do you want me to repeat or explain more any part of our discussion? If you don't want to recap, perfect. I agree with this idea. So she might have some concern which already hidden and she didn't raise them. By this question, she might talk and she might give you another concern that can give you another marks. I believe the concern to be raised by the surrogate better than to be raised by the candidate. Exactly as Dr. Salma did in her scenario. She has, for example,
Yeah.
5 concerns. If she addressed them during the discussion, better than being quiet and you are the one talking, and at the end, she will you will ask her, "Do you have any concern?" Yes, doctor, I have, for example, 5 concerns. Oh my God, 2 minutes left. 5 concerns. Definitely, you will not fill them. So you might fail the concern, even you might fail the scenario because the skills based on this concern. I mean the clinical judgment based on the concern, the clinical communication based on the skill. So the best way is to ask for the concern every now and then during the discussion. For example, after 3 minutes, after 5 minutes, after 7 minutes, but you cannot depend on the time. So you can ask initially, what are your concerns? During the discussion or at the midway between the points, you can ask, you have any concern for me? Then at the end, of course, 2 minutes left, you will ask, what are your concerns? And believe me, by this way, you will gain a lot of marks. As I said, the skills based on the concern, either clinical communication or clinical judgment, and the concern itself. Okay. Thank you, Dr. Judah, for this suggestion. Also, it's nice suggestion. Please, Dr. Judah, don't forget to send these slides to the WhatsApp group so everyone can read it. But there are three types, as I remember, three types: familial one, AL, and AA. The familial runs in family, the AL, which is affecting the kidney more, and the AA, I think it's other organs in the body. Yeah, light chain. And the last one. Anyway, we have to refresh ourselves about this topic as Dr. Salman did. AL and AA. Still AL. AA, yes, AA. There is three types. The familial one runs in family, by the way. So it might be answered in the concern of runs in family, or my kids have it. Yes, there is a possibility. Any question, any comment?
The AL is the primary
Mm,
one,
okay.
and the AA is the secondary one.
Yes,
Of course, the secondary one is
it's the
after
most common.
the most common, and after the long.
Chronic illness.
لا, no, the AL, surprisingly, the AL, the primary one, is the most common, like the presentation of this lady. The AA is, I think, form in developed countries, they written here. The AL is the most common form in the developed country, and the AA, which is the secondary one, is the most common form in developing countries.
Yeah,
And
us.
us, yeah. It is after
In practice.
long-term inflammations like,
Ex-
rheumatoid arthritis, these
Yes, this
things.
is what
Yeah.
I mean. It's common. So it's
Mm,
common
mm.
in our countries, yes,
In
developing
our
countries.
countries,
Yeah, so
yeah.
that's why we have most of type
Mm,
AA, right?
mm. Yes.
Yeah, okay. Thank you, Dr. Salma, again for the topic and reminding and for the practice as well. Dr. Ala, thank you as well for your practice today and everyone for practicing and sorry, sharing the informations for questioning. Anyone has question, please? I didn't ask. Dr. Aisha, we didn't hear you today. Any opinion, any suggestion?
I was late today. Was up. I
No
come and
worries.
discuss.
No worries, Dr. Aisha.
Okay.
Yeah,
Okay,
thank you, everybody. Thank you.
thank you. Okay, seems that's the end of the session today. Thank you, everyone. See you, inshallah, after the weekend. Have a nice weekend. As every weekend, we'll meet on Saturday. Good luck and good night. Assalamu alaikum wa rahmatullahi wa barakatuh.